Does this look like you or maybe somebody else that you know? This is a medication list of an actual patient that comes to our clinic. She's a 63-year-old female on 36 different medications. In addition to seeing us, she has a primary care doctor and 6 other specialists. Each specialist takes care of a specific symptom or a disease process. And with each specialist comes a new medication. Then she ends up with some medications that are offsetting the side effects that she's having from other medications. And then do we really know how all of these medications interact with each other? When they do trials, they really don't have all of those medications that they say. Do they work well with them, or is there a potential for risks? So over the last 30 years, I've been in healthcare. I spent a good deal of that doing acute care. So things like in the hospital, in the emergency room, in walk-in clinics. And at those sorts of areas, we get acute problems. You get the sinus infections, the earaches, the bronchitises, the broken bones. All of these types of things can be treated with current medical models and are self-limiting. On the flip side, however, we have chronic diseases. Chronic diseases are ones that are going to be there lifelong, that are always going to be part of somebody, or so they think, and that they're going to get worse. They're not going to get better. This all includes things like chronic pain, autoimmune diseases, COPD, heart disease. All of these are chronic diseases and are being treated as such. Too many people are having to choose between medications and food and heating. The government has been trying to look at ways that we're going to be able to decrease the cost of pharmaceuticals. There's private companies and people like Amazon and Mark Cuban that have opened up their own pharmacies. And I can pretty much guarantee that they're still making a profit, even at a much lower cost for these medications. So here's a thought. Let's figure out a way to get away from having to require so many pharmaceuticals. Let's get to the core root of why you're having the symptoms. Let's look at all of you, not just the symptoms, because there's a big difference between treating symptoms and treating you. Current medical models are looking at everything as protocols. For a disease process, you treat with X, Y, and Z, and everybody gets treated the same. The unfortunate thing is that not everybody is the same, and sometimes those treatment options are actually making things much worse. Functional medicine works in just the opposite. It works as everybody as an individual. We look at each person. We look at each symptom, but not the symptom. We look at you. And then we can formulate a plan to get you back into balance and to correct this and get to optimal health. So if you're tired of being on the conventional medicine merry-go-round and you're getting shuffled off from specialist to specialist and you're still feeling poorly, if not worse, then click below and set up a 20-minute one-on-one call with me. Let's look at your specific needs. Let's look at your specific goals, and let's come up with a customized, individualized plan to get you to reach your optimal health.